Okay. Well, thank you very much. You are. I sorry, I didn't catch your name. You're Dr.
Hello?
Yeah. Can you hear me?
Yeah, I can hear you.
Okay. All right. Well, thank you very much for inviting me to this meeting of the International Conference on Microbiology and Infectious Diseases today. My name is Martha Menchaca, and I'm with the University of Illinois at Chicago. My lecture is on comparison of positive SARS-CoV-2, the incident rate coupled with environmental and socioeconomic factors in northern Illinois. So in our study, what we did is we had read that there were on previous studies, there were positive associations of concentration of PM 2.5, which are fine inhalable particles with diameters that are generally 2.5 micrometers and smaller. PM 10, which is inhalable particles with diameters that are greater, generally 10 micrometers or smaller. NO2, a highly reactive disease. Ozone concentration, highly reactive gas composed of 3 oxygen atoms. And let's see, so we know that severe acute respiratory syndrome, it confirmed cases in the United States, demonstrated one study showed that 1 microgram per milliliter increased the PM2 is associated with an 8% increase in COVID death rates. So as you can see here, SARS-CoV-2 is also influenced by lots of different factors in the air. For this last week, if you look here at this map of the United States, you see that currently the average rate cases of CoV-2 per 100,000 people demonstrates that the largest number is in the north Midwest here, Minnesota and northern Michigan. Illinois is moderately high rate, and then also in the Southwest here. Some of the states with less average cases per 100,000 are in the South Florida, which is interesting because Florida, as you know, they do not they do not demand that people wear masks, and some of these other states as well. So previously, Chicago and surrounding suburbs have been labeled hotspots in the United States, and correlation with air pollutant concentrations will help identify specific communities most at risk. We use the Ezra ArcGIS Pro, and basically we took the census group data organized within the United States Environmental Protection Agency's EGS screen tool. I don't know if you're familiar with that. And we also merged that with the Illinois Department of Public Health zip code level COVID data. Basically, the United States Environmental Protection Agency EGS screen tool is an environmental, what they call justice mapping and screening tool that provides the EPA with nationally consistent data sets and approaching for combining environmental and demographic indicators. The EG screen chooses a geographic area. The tool then provides demographic and environmental information for that area, and all of the EG screen indicators are publicly available. The EG screen simply provides a way to display the information in a more representative way, and it combines the environmentals, as I mentioned, and the demographics. So let's look at what those environmental and demographic factors are. Well, basically, there are multiple air indicators. One, as I mentioned, particulate matter, PM 2.5, the ozone level, the National Scales Air Toxin Assessment, air toxin cancer risks, the NADA Respiratory Hazard Index, the NADA Diesel PM, particulate matter, and traffic proximity and volume. It looks at the dust and lead paint, the lead paint indicator, wastewater and air, proximity to risk management plan sites, sites that have been designated as increasing the risk of cancer or other pollutants, proximity to national priorities list, again, another important factor, proximity to hazardous waste facilities, and also water, just plain water would be the wastewater discharge indicator. Now, also, that is combined with on the EGS screen with demographic factors. So percent of low income individuals within the Black group. Um, this is where it's less or equal to twice the federal poverty level. The percent of color, people of color, or people who are underrepresented, African Americans or Hispanic individuals in this country, there's designations. The percent of individuals in a Black group who list their racial status as a race other than white alone. As you know, Hispanics, some of them are designated as white mostly, but they are of Hispanic background. And so they have linguistic isolation areas, etc. Less than a high school education. So a percent of people age 25 or older whose education is short of a high school diploma. Next, linguistic isolation scale. Percent of people in a Black group living in linguistic isolation households, and a household in which all members age 14 years and over speak a non-English language, also speak English less than very well. Individuals under the age of 5, individuals over the age of 64, and there is a demographic index that is sometimes taken into consideration, which looks at the average of two demographic indicators, percent low income and percent minority. Let's see, we're on 8. Yes. Okay. Just coincidentally, last week, a ProPublica journal, or how do I want to say this? It's an academic periodical, came out with a study on using EPA cancer-causing air toxins. And they also have looked at, it's a 2-year study. They took into consideration all the air toxins from the EPA in a class of 187 chemicals. And as you can see here, in this particular area, you have downtown Chicago here in the center. And down along the southwest corridor, which is coming very importantly to what we found, is that there are areas here that have higher what they call rescreening environmental indicators in this particular area. So air pollution is high here. This is an area which we can look at, and we'll see this is about the zip code encoded in here is 60623 and other zip codes in that area. So we took that and then we also merged it with the Illinois Department of Public Health zip code information. And basically on this website, you can find the full cases. As of this morning, we have about 17 million cases of positivity. I apologize. We have 1,784,000 positivity. They have the 7-day variant cases, which they keep track of. The confirmed deaths, which is approximately 26,000. They also have probable deaths, but not in the confirmed. And the total performed are 38 million. So out of 38 million or so positive, 1,784,000. So what we did is we looked at the this is the COVID death, COVID rate here, and as you can see, there's the numbers that are darkest would be here. This is zip code 60623 is one of the higher ones, and some of the other areas you can see in surrounding counties. This is Cook County. We have DuPage County. We have Kane. We have McHenry, and we have Lake. So there's a couple of areas here that are pretty dark. We have an area here is similar to the area that has a higher pollution rate, also has the highest, but it also has maybe higher density of people. And then some of the other areas do not have as high a infectivity rate. Now we look at the EGS screen, the Environmental Demographic Indicator ranking total in Cook, DuPage, Will, Lake, Kane, and McHenry counties. And Chicago is in Cook County, and the surrounding suburbs, as you can see. So this is looking at the EGS screen, the Environmental and Demographic Indicators. So here we have the same area, which as you can see has very high EGS screen indicator. Again, the area that has the highest pollution. So then what we did is we combined those maps together and said, well, which ones would be most most affected with higher rates of infectivity and higher rates of pollution. And we came up with our final map using the geocoding. We found again that the highest rates are here in the southwest part of the city, um, involving the edges of Cook County. So what we can say is our results showed this. The analysis found a positivity relationship between zip code SARS-CoV, incidence rates, and environmental and demographic, e.g., indicators. The evaluation of race and SARS-CoV incident rate at the zip code level found positive moderate correlations for ethnic minority individuals, focused on Latino populations, Hispanic populations, mostly, and African Americans at some levels. Positive relationship between SARS-CoV incidence rate and environmental indicators. Positive correlation between SARS-CoV incidence rate and race and ethnic indicators. And so if we were able to use our public health tools, we can focus resources, can be more efficient, coordinated to areas with the highest risk-based factors. And contact tracing. Some limitations of our study, a limitation of our research is we were not able to correlate in this particular study for other chronic medical conditions, as you all know, such as hypertension and diabetes, which have a higher incidence of mortality, whether or not that affects it. And our preliminary on another study that we're working on demonstrates that mortality is higher in other areas. Now, why might that be? That's because people with chronic diseases who not necessarily are affected in 60623, those individuals are older individuals. Maybe they don't live in that area, but they're higher for mortality. So, additionally, another limitation is the underestimation of positive individuals who never got tested. As you know, a lot of people don't even know that they have the disease or the infection, and later on they found out they had the antibodies. They have very mild symptoms. I know somebody who definitely had the disease because they had the antibodies. They didn't even remember being sick. So another thing is utilizing a probability analysis. Researchers found that there is an underestimation of actual individuals infected with severe acute respiratory syndromes covering this disease, which may be up to 9 times the confirmed number of those actually tested. And so that some limitations. In our future research, we will do the importance of air quality and socioeconomic factors must be further understood for more targeted public health response to the communities that are disproportionately affected by higher rates of positive. The effects of long-term air pollution on individuals, including lung diseases that potentially contribute to higher infectivity. And also, I am involved now in a study looking at the long-term effects of pulmonary conditions on these individuals who have COVID and are not getting better. We're trying to look at some of the lung findings that are permanent, even in young individuals. Thank you very much.